Ladies and gentlemen, you know, what's going on in California is really a lot like what's going on nationwide when it comes down to the coronavirus. So, this came out in The Guardian. Hard hit Southern California to receive 5,000 body bags in 60 morgue trucks. So, this is December 16th, 2020. Wow. California is distributing 5,000 body bags, mostly to the hard hit Los Angeles and San Diego areas, and has 60 refrigerated trailers standing by as makeshift morgues in anticipation of a surge of coronavirus deaths. The precaution comes from the hospitalizations that now are double the summertime peak seen in the pandemic and which threaten to soon overwhelm the state's already taxed hospital system. Gavin Newsom, California governor, said Tuesday that the number of average daily deaths have quadrupled from a month ago. The surge is forcing an urgent scramble for more staff and space, a crush that might not abate for 2 months despite the arrival of the first doses of the vaccines this week. On Tuesday, the number of average daily deaths stood at 163, while positive cases surged to more than 32,500 a day. Of those new cases, an anticipated 12% will wind up in the hospital, and 12% of those hospitalized will crowd already stretched intensive care units. That means one day's worth of cases can be expected to produce a staggering 3,900 hospitalizations and nearly 500 ICU patients. On Wednesday, the state reported more than 53,700 new cases and close to 300 new deaths. We are in the middle of the most acute peak, Newsom said, urging residents to take precautions to slow the spread. In Orange County, the health officials said they plan to send large tents to 4 hospitals to help make their patient caseloads. Okay, so they're trying to, handle caseloads in these tents because it is just too much. I guess those are the overflow that they just can't take in the hospital. In San Diego, most emergency departments have been overwhelmed that they have, they had to turn away ambulances. Wow. Oh, wow. Okay, yeah, I'm just looking at a picture of the tents that they are talking about. Woo, it got that bad. After initially garnishing praise for bringing the virus under control, California is grappling with the deadliest surge since the pandemic began. The hospital space is dwindling fast, with the most intensive care units filled to capacity. In the San Joaquin Valley, California Agriculture Hub, ICU beds availability recently dropped to zero for the first time. Statewide, overall, the ICU capacity dropped to 5.7% as of Tuesday. In Fresno County, officials said Tuesday that just 16 ICU beds remain available, and they were filling rapidly to keep up with the county's hospital system that contracted with a Virginia company to supply doctors and nurses and other staff with a 50-bed facility that will start receiving patients at the end of the week. Unfortunately, I'm anticipating a grim set of weeks before and after the new year, just given the trend that we're seeing with the number of cases. Nearly all Californians have gone back under the nation's most strict lockdown, which divides the state into 5 regions and is tied to ICU capacity. When ICU capacity drops below 15%, the lockdown is triggered. The new restrictions ban all non-essential travel and require people to stay home and minimize non-essential contact outside their household. It also banned restaurants from both outdoor and indoor dining, prompting a backlash from many restaurant owners who say their businesses are already on the brink of collapse. Well, that's what I actually see for 2021. I see a lot of businesses falling and they're going to be gone permanently. I mean, I even believe that's going to be very prevalent in the area that I'm in. Southern California has remained one of the hardest hit regions throughout the pandemic. In Orange County, health officials said mobile field hospitals would be rolled out to 3 hospitals that already need more space. The large, heavy-duty, temperature-controlled canvas tents with hard flooring add 125 beds. So that'll be extra beds that they'll be able to use. So they're talking about emergency rooms have no capacity to triage people as quickly as they can. So even their emergency rooms are just completely overwhelmed. I've never been so afraid of Christmas and New Year's in my life. I can't imagine what it would be like after the holidays if people are not listening. California has brought in 507 extra staff and deployed them around the state, though most do not have the skills to help in ICUs. The state is seeking a total of 3,000 contracted medical staff. 2 weeks from now, we are concerned about our ability to provide the same level of high quality care will be. So right now they're saying they are in fear of these upcoming holidays because they have what they call holiday surge on top of what's going on right now. And I believe what's going on right now is contributed to those people that traveled around from Thanksgiving. That's why it's so exceptionally bad this week. Hospitals are very challenged. That will only get worse and potentially far worse in the next 30 days or so. In a rare bit of good news, Newsom said that nearly 394,000 more doses of Pfizer vaccines could arrive in California next week, on top of the nearly 328,000 doses being distributed at 33 locations this week. On Monday, an ICU nurse became the first Californian to receive the Pfizer vaccine. Okay, so, I know I got quite a few subscribers out in California, and all I can say is just be careful out there, especially in the coming weeks. In fact, wherever you are in this country, be careful because it is right now, COVID is uncontrollable. It really is. They don't know what to do. And it's just getting worse by the moment. But y'all, please tell me what you think. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.